Disorders Awareness Week is an international event tackling stigmas and misconceptions surrounding anorexia, bulimia, and binge eating disorder. This year, the focus of Eating Disorders Awareness Week is the question, why wait? On average, it takes 3 years for those experiencing eating disorder symptoms to seek help. A YouGov survey conducted for Eating Disorders Awareness Week found that more than 1 in 3 adults in the UK could not name any signs or symptoms of eating disorders. The sooner somebody gets the treatment that they need, the more likely they are to make a full recovery. This year's campaign aims to increase the training and knowledge given to mental health professionals to help them spot the early signs of an eating disorder. As well as helping to increase early access to treatment, this should reduce the risk of possible misdiagnosis. Here are some facts about eating disorders from the John Hopkins All Children's Hospital. 30 million people in the US have an eating disorder. 95% of people with eating disorders are between the ages of 12 and 25. Eating disorders have the highest risk of death of any mental illness. Eating disorders affect all genders, all races, and every ethnic group. Genetics, environmental factors, and personality traits all contribute to the risk of developing an eating disorder. And here are some myths about eating disorders. Myth number 1. Someone with an eating disorder is only affecting their muscle and body fat by not eating. The truth is, eating disorders lead to severe malnutrition that affects nearly every organ in the body. Malnutrition can cause a dangerously low heart rate or abnormal heart rhythm. You may feel dizzy, pass out, or the heart could ultimately stop. You may have irritability, mood changes, and difficulty focusing. The stomach and intestines may work slower, leading to pain, constipation, or bloating. Females may stop having periods, which weakens bones. Males may develop low levels of testosterone. You may develop anemia, poor immune function, and bleeding disorders. Children who haven't started puberty may have delayed puberty or slow growth. Myth number 2. Eating disorders are a choice. The truth is, eating disorders are a complex medical and mental illness that patients do not choose. Myth number 3. I caused my child's eating disorder. The truth is, eating disorder researchers and clinical experts believe that eating disorders are caused by both environmental and genetic factors. People's genes put them at risk to develop an eating disorder, and then different social pressures may cause them to develop the disorder. Myth number 4. Eating disorders only occur in females. The truth is, although eating disorders are more common in females, they can affect anyone, regardless of their gender or sex. Myth number 5. It's uncommon for a child to have other mental illnesses besides their eating disorder. The truth is, it's very common for people with eating disorders to have other mental health disorders such as depression, anxiety, or obsessive compulsive disorder. Myth number 6. You can't die from an eating disorder. The truth is, eating disorders have the highest mortality rate of any psychiatric illness. Up to 20% of people with chronic anorexia nervosa will die as a result of their illness if it's not treated. Myth number 7. Eating disorders are rare. The truth is, eating disorders are the 3rd most common chronic illness among adolescents after obesity and asthma. Myth number 8. Once a person with an eating disorder gains weight, then everything will be back to normal. The truth is, it's important to remember that an eating disorder is not just about weight or food. Mental health care is one of the most important parts of recovery. A patient will need help managing their emotions and thoughts around their relationship with food. This is why having a mental health provider such as a counselor or a therapist is so important in the treatment of eating disorders. Myth number 9. A patient will never recover from an eating disorder. The truth is, with treatment, 60% of eating disorder patients will make a full recovery. For more information on Eating Disorders Awareness Week, follow the links in the description section of this video. And remember, your mind matters.